Okay. So today, basically, this is our first class on our course, that is for AKP crash course. And today we will going to discuss ECG. This is the free class, and tomorrow again a practice class for ECG. And we will cover or we will discuss many ECGs as possible to practice the things which we cover today. Okay, so both of the classes will give the best idea about how to read ECG. Okay, so let's start with this. Okay, so first of all, what is ECG? ECG stands for, it is an electrocardiography. Okay, so it is related to the electricity, it is related to the current and everything. So in our heart, the basic the electricity which is the current which is generated from the SA node, we can see this SA node is located in the right atrium, and from the SA node, the current goes to the atrium in the right atrium, and then it goes into the left atrium. Okay, and after that the current from the atrium it's end into this AV node, atrioventricular node. At AV node the current pause over here, okay, for a little bit. Okay, and this pause is also shown on the ECG, and we will going to cover it. Then from the AV node, we have the bundle branches. Okay, you can see over here, this is the bundle of His. And from there to the branches, the right bundle branch and the left bundle branch, which basically supply the electricity to each ventricle. Okay, and then it ends over here, the electrical activity then ends over here. Then another, again the next cycle or the next electricity again arises from the SA node. Okay, so when the SA node started and when the electrical activity goes to the atrium, it causes atrial contraction. Okay, so our phases in ECG, we will going to cover it. But in ECG, the first thing is atrial depolarization. When atria contract, then what happened? The electricity goes to AV node. So then there is a break or there is a pause over here. Then from the AV node, the electricity goes to these bundle branches into the ventricle and causes ventricular contraction that is seen by in the form of QRS complex. Okay. Then after ventricular contraction, the ventricular starts to relax. So the first state of the relaxation is causes ST segment, and then the ventricle started to completely repolarize, or you can say that the electrical act, the chemical like sodium and potassium, they are going through the with the help of at the time of contraction, we all know that sodium goes into the cell, and when at the time of relaxation, when the repolarization going on, the potassium is going out of the cell. Okay, so that repolarization phase is causes T wave, and we will cover all this in subsequent slides. Okay, anything if it is not clear at any time, you can directly ask. Okay, don't wait for the end. Okay, the next is the ECG. How you going to read ECG? The first important thing is that you have to calibrate this ECG paper. Okay, so what is a calibration? The important thing you can see over here, in this you can see this is the ECG paper. Okay, this red is the ECG paper, and in the ECG paper we have a very small box, which is this. Okay, this is a very small box, and this small box, this one small box, and then you have a large, this is a large box. Okay, this is a complete one large box, and in the one large box you have this small boxes are there. So how you going to read those ECG? So like any you can say, this is for example ECG, it has a x-axis. Okay, this is, it has a x-axis, and it has a y-axis as well. Okay, so at the x-axis, ECG में speed is going on. Okay, it tells you about the speed, how the speed of the P wave, how much time the atrial
अच्छा नट
repolarization
करें
or atrial
ओ ट्वाइस
depolarization.
कर दें
Mute
ट्वाइस कर दें
everyone, please mute. Kindly mute your mics. Thank you. Okay. So in ECG, the x-axis, like this axis, I'm telling about this axis, this is telling you about the speed. Speed means the time taken for atrial depolarization, ventricular depolarization. It's the speed, it is the time, okay? So one box. So if this small one box, which I colored, it is equal to how many seconds? It is equals to 40 milliseconds. This is a small box which is equal to 40 milliseconds. Okay. And again, in the y-axis, if I'm talking about this y-axis, y-axis is telling you about the amplitude. It tells you about the voltages. Okay. So x-axis tells you about the speed, and in the length, in you can say in the longitudinally or vertically, it's tell you about the voltages. And we have a significant, it has importance for that. Amplitude importance is also there. Okay, and we'll see it why it is important to check the voltages as well, because if we have very very small QRS complexes are there, it again tell you some pathology. Okay, so voltage is normally the one box. So if again the one box, the voltage of one box is just equals to zero point 0.1 millivolt. So one small box is equals to 0.1 millivolt. Okay, so it is written in this box that one small box is equals to 40 millisecond time. That time is refers to speed, and zero point 0.1 millivolt is represented by the amplitude or the voltages. Okay, so this is about a very a small box, our smallest box. You can say one small box. Now we talk about the large box. Okay, so this is the large box. So the large box contain 5 small boxes. One large box. You can see over here. This is the ECG one large box. Okay, in this you can see this is one large box. This one large box contains 5 small boxes. 5 small boxes in vertical direction as well. If you just calculate in a vertical direction, kindly mute if you do not have any question, please. Okay, so what I tell you, okay, in this box, the large box, we have 5 small boxes in a vertical direction as well, and in a horizontal direction as well. So we have already discussed that one small box is, if we talk about the speed, if the x-axis, it is equals to 40 millisecond. So if we just multiply 40 with the 5, it will going to be equals to 200 milliseconds. And if we convert this milliseconds into second, it will be equal to zero point 0.2 seconds. 0.2 second. So this one large box, it is comprises of 0.2 seconds. Okay, and if we take in a vertically if we take it, then again in the vertical direction, it again has 5 boxes. And we already discussed that one small box is equals to 0.1 millivolt. So the 5 boxes with going to be equal to 0.1 multiply by 5, it will be 0.5 millivolts. So 0.5 millivolts, okay? And if we take 5 box, the one large box, it will equals to 0.5 millivolts. Okay. चलो ठीक है आपके लिए. Okay. Now we talk about what do you mean by ECG calibration. So we have already discussed small box, large box, and I've given you the calculation, each small square, the speed wise, the amplitude, the voltage wise. Now, what happened at the start of the ECG or at the end of the ECG? You always look for this box. This box is very, very important. This box is very much important. You can see this box. I'm talking about this. It tell you about the standardization. Okay. The first thing which we look in our ECG is standardization. क्या machine जो है at this time it is fixed on the standard you can say calibration or okay. So ये आपको ये standardization it is very important. Why this important? And we will going to discuss this. Okay. So ये आपको टेबल इस टेबल अगर आप इस जो आपकी नॉर्मल स्टैंडर्डाइजेशन है, if we talk about the normal, then it is comprises of 10 box vertically. Okay. So normal जो आपकी standard ECG है, the amplitude जो उसका set होगा machine पे, it should be equal to 10 boxes, means two large box. This is vertically, and horizontally it should comprises of 5 boxes. Okay, so ski speed जो होगी वो 20 milliseconds पे होगी, which we just discussed, 20 milliseconds पे होगी. But vertically जो इसका amplitude है वो होगा 0.10 millivolt का means क्या हुआ? It is equals to 1 millivolt. Okay, so if we talk about the 0.10, because 1 is equals to 0.1, so if we multiply 0.1 multiply by 10 boxes, it will equal to 1 millivolt. So the standard would be 1 millivolt in a vertical wise, and the speed would be 200 milliseconds. Okay. So we will see why this is very important in the coming up ECGs. Now, this is again the same thing which I discussed. Again, it will tell you about that one box is equals to 0.1 millivolt in a vertical direction, and speed wise it is equals to 0.04 seconds. Okay. Now, when we talk about ECG, what we look basically. So when the ECG starts, we already discussed first the P wave appear. This is the P waves. Okay. First, the P wave appear, and P waves basically tells you about depolarization of the atrium. Atrium first is the atria. So atrium depolarization is shown by P wave. Then what happened? This is a straight line. This is a straight line which we called it as PR segment. This is PR segment which connect P waves with the Q wave. This is first Q wave. Okay. So the P wave connects the Q wave. So it is PR segment. And why this PR segment is occurring, it basically tells you the delay of AV node to allow filling of the ventricles. So it is the conduction, or you can say the electrical activity delays at the level of the AV node, which is represented by the PR segment. And then after some time, it goes, the electrical activity goes into the ventricle and QRS formed. This QRS complex tells you about the depolarization of the ventricles, means that ventricles are contracting. At the same time, when the ventricles are contracting, the P wave is basically, the P wave is relaxing. The atrium is relaxing. Because atrium is a very small chamber, the relaxation, or you can say the repolarization of the atrium is buried in this QRS. Okay, it is buried in this QRS complex. So you cannot see atrium repolarization on the ECG. You just only appreciate depolarization. Then you have this AV node delay followed by this QRS. Okay, QRS is a ventricular depolarization. Then after the depolarization, ventricular, you can say contraction occur, that ST segment appear. This STS segment is the segment which is isoelectric. Isoelectric means there is no current going on. No means no, not the sodium or the potassium. These electrolytes are not going in any direction. The isoelectric phase, okay, and it is the start of ventricular repolarization. If anyone asks you start of the ventricular relaxation or a start of the ventricular repolarization, it is the ST segment, which shows you the beginning of the ventricular repolarization. And at the end, the repolarization occurs. And I told you at the time of repolarization, the potassium will goes out of the cell. And this repolarization is represented by the T wave. Ventricular is relaxing. Okay. So these are the important things which you will going to see on ECG. And you should know what basically they are telling you. Now look at this. Okay, now it seems again a complicated, but see what we are seeing in the ECG. We'll going, first of all, we have waves. Okay, so we see waves. So we have three waves which we see on the ECG. The first wave which we see on the ECG is the P wave. The second is this QRS complex wave. Third is the T wave. This is the normal, okay, normal in every ECG of the normal person or a normal child, as we are talking about pediatric ECGs. So the normal children, the ECG should contain these three waves. Other than these three, you may have other waves as well, which we call them as a pathological waves. Okay, so pathological waves like delta waves, like Q wave, deep Q wave, small, you have just a small, sometimes you have very deep Q waves. You may have you can say J waves. So these are the other waves. They are showing pathology. But if you say normally in every person, you should have these three waves. Okay, so P wave, QRS, and T wave. Okay, in some time in normal pathology, you may have U wave as well, which is just after the T wave, after the depolarization. You may have sometime a very small wave, but it will not appear in every child. Okay, so but in some normal children, you may have this. Okay, so first thing in the ECG is the waves, which we have already discussed about waves. Second thing in the ECG which we look is the segments. So there is a difference between segments, and the third thing is interval. So who will going to tell me is what is the difference between the segment and the interval? Anyone will going to answer for this question? Difference between segment and interval? No? Okay, let me answer. So what is a segment? What I told you, first of all, I'll tell you about the segment. So we have two. Hmm? Yes.
Segment does not contain any wave.
Very good, Maria. So segment is basically does not contain wave. So I'll explain it, and but your answer is good. Perfect. So what is the segment? So in our ECG, we two important segments are there. First, I already told you this segment, only this part, which connects P with the Q, which we called it PR segment. PR segment. And the second segment, which is important, is the S wave, the S at the end of the S and beginning of the T. This segment is called ST segment. ST segment. So these two segments are very important. Okay. So other segments are not that much important. You should know these two segments. So what is the interval? Mari is absolutely right. Interval basically should have wave plus segment. Wave plus segment. Okay, it's wave plus. The first interval is PR interval. So what I told you, it should contain wave. So it should contain this P wave. It starts from the beginning of the atrial depolarization, from the start of the P wave till the end of till the start of ventricular depolarization. This segment is called PR interval, which is very, very important, especially when you are dealing with the questions like blocks, hard blocks, and we will discuss them. Okay. So PR interval contain P wave plus PR segment. P wave plus PR segment. The next very important interval which you should know is the QT interval. And QT interval, again, it starts from the beginning of the ventricular depolarization Q. Start from Doctor, kindly mute yourself. Okay. So what basically ventricular QT intervals tell you? It starts from the beginning of the Q wave first, and then it ends after repolarization. It ends after repolarization. From the beginning of the ventricular depolarization and ends after the ventricle relax or repolarize. So it consists of two waves, QRS complex plus ST segment, which is marked with the yellow color, ST segment, and it contains T wave. So two waves, QRS, T wave plus ST segment, which is comprises of the QT interval. Okay. Now they have shown you the durations as well, and we will discuss the duration, as we will going to cover more. So we will discuss the durations as well. Okay. So this slide is basically the repetition, which we have already covered. Okay. And the important thing, QRS complex, let me tell you, it is comprises of three waves. This QRS complex, the initial negative deflection. So what do you mean by negative deflection? Negative deflection, consider this is your straight ECG line. This is your straight ECG line, or you can say isoelectric line. Then first, negative means downward. This is if the wave is going in a downward direction, this is called negative deflection. So first negative deflection is represented by Q wave. Then positive deflection is represented, second positive, ये upward direction में it is positive, and it is represented by R wave. Then again dip negatively, it is go down, then come back. So this negative deflection is called S wave. Okay. So it is basically comprises of Q, R, and the S. Now, how to read ECG? Okay. Now, this is our basic talk. Before this, we are just kindly. Okay. Before that, we were only talking. Okay. So how to read ECG? So if you start reading ECG, you have these all components. Okay. First, before always start ECG, check for the standardization. Is your machine set on proper calibration or not? This is very important, because if it is not properly calibrated, I'll tell you, the complex size would be affected. Please remember, the standard calibration should consist of 10 boxes in a vertical direction, and in the horizontal direction, it should comprise 5 boxes. If this calibration is normal, then you would have a normal size QRS complexes. If it is small, for example, if it is only vertically, if it only has 5 boxes, this calibration is half. This is not full standard. Then the same person has a small ECG, or you can say small complexes would be on the ECG paper. That is why the first step is to check for standardization. Then second, we check for the rhythm. Is the rhythm is normal, regular, sinus? We'll discuss all this in detail. Then we look the heart rate. What is the rate going on in the ECG? Then we cover the axis. What is the axis? Means the overall current direction in the heart. This is very important. We have to check because it will tell you which chamber of the heart is working strongly or more. The axis is give you idea about the overall, the sum up electrical activity in the heart is in which direction. Then we see the waves. We already discussed we have three important normal waves, P, QRS, T wave. Then we see the intervals and segments. And in the last, we check for the chamber hypertrophy, which ventricular hypertrophy, atrial hypertrophies. So in the last, we check for the hypertrophy. So this is all which we going to cover. If we see the ECG in this way, we will not miss anything. Believe it, we will not going to miss anything. Okay. So let's start with the standardization. So you can see I've already tell you. So in the ECG, this tell you full standard, and then in the below this tell you half standard. Why half standard? Because it comprises of 5 boxes in a vertical direction. Okay, this is not also appropriate. Okay, so you should see this bar or this line should be on the ECG. In some ECG, it is present in the start of the ECG, and in some ECG, you can see this line at the end as well. Okay. So for okay, so you can see if you do not have a proper calibration, you may have these QRS complexes. The size, the amplitude would be very, very small. You can see it's so small. It is very small. So now this is okay related to the standardization. If it is set on the half standardization, but if this your standardization is normal, if your standardization settings are normal, and still you have these very, very small QRS complexes are there. So what do you think? Which pathologies are associated with it? Any guess? Any differentials from your side, if you can? Okay. So for example, your standardization setting is okay. Okay. And still you have a very low voltage QRS. Then how you going to label it?
Pericarditis and pericarditis, there will be low voltage QRS complexes and
Very good.
it will be low.
Pericarditis, pericardial fluid. Okay. So any fluid around the heart. It could be pericarditis, it could be pericardial fluid, it could be pleural effusion, it could any air around the heart, like for example you can say pneumothorax. So any compression from on outside on the heart. Okay, you may have just a second, I need to take a call, just a second. Take second, just a second. Okay. Okay, am I audible? Okay, so you are absolutely right. Even if the person is very, obese, fatty person, in that situation also you may have a very small or you very low voltage QRS complex. So how you going to label it? Yes. How you going to diagnose is, yet it is low voltage. So you have to see the leads. Okay, so in the ECG you have two type of the leads. Okay, you have limb leads and you have precordial leads. So what do you mean by precordial leads? Precordial leads, if you see, first see the leads. Okay, so what are the precordial leads? Precordial leads are those leads which are attached on the chest. So you can see it is present on the chest. So V1 to V6, the 6 leads are attached on your chest. Okay, V1 is on the right side, and from V2 to V6 it is on the left side. Okay, so these are the precordial leads, and those leads which are attached on your limbs, see, these are attaches on the limbs, they are called limb leads. Okay, limb leads. So in limb leads you have, which leads you have? On the ECG, it is written as lead 1, lead 2, lead 3, and it is written as AVL, AVR, and AVF. So you have 6 precordial leads, which is represented on ECG by V1, V2, V3, V till V6. This is 6 precordial leads, and you have 6 limb leads, which are represented by lead 1, lead 2, lead 3, AVL, AVR, and AVF. Okay, so we'll see all these leads. So how, when you will going to label it that yes, it is really a low voltage, even you have normal standardization, you have to see that the limb leads, the complex length. If you see the limb leads, the complex length should be less than 5 millivolt. So what do you mean by 5 millivolt? Means that if you see the one large box, the one large box was equals to 0.1 millivolt, which is equals to 1 double millivolt. See? So 0.1 millivolt is equals to 1 millivolt. So the complex size, if 5 box has 5 millivolt. So the complex size should contain smaller than 1 box, okay, in the limb leads. And you see basically the length of QRS. So this is the length. You see the length of the QRS complexes. And if the length is smaller than the 1 box, 1 large box in the limb leads, it is suggested that your ECG is low voltage. It is not adequate. So if you have any time with very, very small box ECG, the first thing, check standardization. If standardization is normal, then think about other pathological causes. And what about the precordial leads? In the precordial leads, the length should be less than 10 millimeter. Okay. So this is the criteria for low ECG leads. So just check it on this ECG. Okay. So what I told you? These are your precordial leads. Okay, it is represented by V1, V2, V3, V4, V5, V6. And what I told you, the size should, you see, for amplitude or for voltage, you see this QRS complexes. The size of the QRS complex in the precordial lead should be less than 10 millimole, means less than 2 large boxes. So these are less. You can see it is less than these 2 boxes. That means this is low voltage. And same if you see this type over here on your right side on the left side of your screen, these are your limb leads. Again, they are also 6 in number. And in this lead, you can see the length of the QRS complex or the height of the QRS complex is less than 5 small boxes. So 1 box is equals to 5 millivolt. So the size is, you can see it is less than this 1 box. Okay. So in that way, you can diagnose it. This is a low voltage lead. Okay. Now we talk. Now, what are the important differentials? As already she told, anything around the heart make the life easy. So you can see any fluid, whether it is in the pleural cavity, in the pericardial cavity, where fat means obesity, air like emphysema, pneumothorax, any infiltrative things are there. For example, in amyloidosis, you have an abnormal amount of the protein accumulated around the heart. Hemochromatosis means abnormal iron accumulation around the heart. Constrictive pericarditis means constructive fibrin, or you can say like these fibrin and the which causes this around the heart and unable to make them relax or unable to make them stretchy. स्ट्रेच नहीं होंगे, फाइब्रिन होंगे अराउंड, तो फाइब्रोसिस होना स्टार्ट हो जाएगी. So all these situation. And in the last, you can see if you have any massive MI, it means the heart is not contracting at all, or you have dilated cardiomyopathy, the heart is fully stretched and heart is not contracting at all. These all things can problem, or you can say it, these all things will make the low voltages QRS complexes. Okay. Okay. Now the second thing after standardization, the second thing is to check for the rhythm. Okay. This rhythm is very, very important. Why it is very important? It will give you an answer that either you are dealing with the normal ECG or you are dealing with arrhythmias. Okay, so you are always fear of this word, oh, doctor, how I'm going to, diagnose these arrhythmias? It looks me very difficult. So the first thing, the very important thing is to check for the rhythm. So first thing, if you see over here, two things are in the rhythm. The first thing is that whether this rhythm, this electrical activity is generated from SA node or not. Okay, the first thing is whether it is sinus or not. The sinus means coming from sinus SA node. So if it is arising from SA node, the QRS complex should be preceded by P wave. Always remember. So whenever you are seeing any ECG, see, these are your complexes. It should preceded by P wave. It should preceded by P wave. It should preceded by P wave. You are relaxed. Okay, means current is producing or originating from the normal pacemaker. It is not arising from other foci, other loci, you can say, other focuses. Ischemic focuses can also produces abnormal currents. So it means P wave means it is sinus. It is coming from the a normal pathway. Second thing, what you're going to see is that whether the duration, or you can say the speed, or you can say the distance, the actual word is the distance between two R waves. This is the two R waves. The distance between the two R waves is equal or not. This is the second thing which you're going to see on the ECG. So rhythm comprises of two things. First, it is a sinus. Second, it is the distance between the two R waves is normal. Okay. Is this clear? P wave must be followed by QRS complex. QRS complex must be preceded by P waves. Okay. So now we talk about the rhythm. So you can see over here, the first question we have already answered. Yes. Do you see the P wave in this ECG, everyone? See, this is the P wave. See, this is the P wave. This is the P wave. This is the P wave. This is the, okay, so you can see P wave. You see, this is sinus rhythm. Okay. And between the RRR, this is also normal. This means that this is called sinus है, ठीक है? Sinus, and it is regular rhythm. It is originating from sinus and it is a regular rhythm. Now what happened? The second thing is that if your rhythm is not regular, now you are dealing with the regular thing, you are okay. But if your rhythm is not regular, okay, regular nahi hai. What do you mean by regular nahi hai? Regular का क्या मतलब है? RR waves का distance same नहीं है. That means it is irregular. So irregular के अंदर आपने क्या चीज important देखनी है? If you have a rhythm which is regular या irregular, कोई भी हो, पहली चीज जो सबसे पहले सर्च करनी है रिदम में, वो क्या चीज सर्च करनी है? पी है कि नहीं है, वो साइनस है कि नहीं है. ठीक है, अगर आपको पी वेव मिल रही है तो आपकी पॉसिबिलिटीज बिल्कुल नैरो डाउन हो गई है. ठीक है, यू सी ओवर हियर कि अगर आपके पास पी वेव मौजूद है और आपकी रिदम इरेगुलर है, तो आप उसको क्या लेबल करते हो? साइनस इरिथमिया. क्या लेबल कर रहे हो उसको? साइनस इरिथमिया. तो साइनस इरिथमिया क्या होता है? P wave is there and arrhythmia mean is that irregular rhythm. So if your rhythm is regular, then you move to the next step. Regular भी है और P wave भी है, दोनों चीजें होना जरूरी. रेगुलर भी है, P wave भी है. तो अब आप नेक्स्ट स्टेप जो हमारा था कि हम रेट देखने जाएंगे. ठीक है, तो नेक्स्ट स्टेप जब हम रेट हम डिस्कस करेंगे तो उसमें नॉर्मल रेट है, ब्रेडी में है, टैकी में है. दिस इज डिफरेंट थिंग. ओके, so now we look at what is sinus arrhythmia. So in this ECG, what you can see over here, that you can see over here that what you see over here, that you can see the distance between these two R wave and the distance between these two. Is it normal? No, it's clear cut that the distance is decreased over here and distance is increased between these two R waves. That it means you are dealing with arrhythmia. Now, what I told you, whenever the rhythm is irregular, you should see P wave. Yeah, I can see P wave, P wave. I am happy. I'm very, very happy. Okay. Because I accept this, irregular wave. I can accept this irregular wave if it is all preceded by the P wave. So we call it sinus arrhythmia. Why this occur? Is this a good thing? Yeah, it is very, very good thing. See the word, what I written over here. If you have a present sinus arrhythmia, it typically indicates good cardiovascular health. See, it is indication that your cardiovascular health is good. So why this occur? Why sinus arrhythmia occur? It is because of the respiration. Okay. So you can see over here, when you inhale, when you inhale, the complexes come closer to each other. And when you exhale, they will going or they become apart from each other. Okay. So this relation is related to your respiration. And why respiration cause this? Because of activation of the vagus nerve. And what is the function of the vagus nerve? Every time when the vagus nerve activated, it acts on the AV node, it blocks the electrical impulse to go into the ventricle. It basically delays the ventricular depolarization. AV नोड पे वेगल स्टिमुलेशन एक्टिवेट होगी. वेगल स्टिमुलेशन जब एक्टिवेट होगी, AV कंडक्शन जो है वो डिले होगी, and that delay will cause delay in the ventricular depolarization. Okay. So this is your sinus arrhythmia. So if we are dealing, what are the things which you are dealing with the P waves or sinus? You have three conditions. Okay. Either you are dealing with this normal rate, normal person, or you dealing with sinus arrhythmia, sinus tachycardia, sinus bradycardia. So in sinus tachycardia, what you're going to see over here, only the rate we will cover it. Okay. The rate means that the distance between become closer. Okay, the rate is fast. Okay, and all is preceded by the P waves. That means this is sinus tachycardia. And what is sinus bradycardia? You see the distance between the two R waves become increased. That means the heart rate goes down, but every QRS is preceded by the P waves. So we call it sinus bradycardia. And sinus arrhythmia we have already discussed in detail. Okay. So after the rhythm, now our second phase, third phase, we have already discussed standardization. We have discussed the rhythm in detail. Now we'll talk about the rate, how you will going to calculate the rate. So for rhythm and the rate, for rhythm, please remember, for rhythm and the rate, you will going to look for long lead. What do you mean by long lead? Long lead could be any lead, but most of the time in your ECG, the long lead is lead 2. What do you mean by long lead? Do you have any idea about it? What do you mean by long lead? नहीं idea?
10 सेकेंड्स तक जो है वो हम लीड को जो है वो 10 सेकेंड्स तक लेंगे और उसमें फिर देखेंगे कि जो है ना
Very good.
हमारे
So in
जो है
this
और
ECG,
उसमें
you
हम
can
आगे और
yes, yes,
देखो भी
doctor.
तो तुम्हारे साथ कोई नहीं है नाइट में.
डॉक्टर आप अपना शेड्यूल प्लीज म्यूट करके डिस्कस कर लें.
अनु
Yes, yes, Dr. Muzammil, you are right, absolutely. See over here.
ma'am.
You see, yes.
Ma'am, why
You
only
see,
lead 2 is called long lead?
yes. Basically, it's not the lead 2. Most of the time, the lead 2 is on the long strip. Any lead on the long strip, you can check it for the rate. It is not necessary कि आपने lead 2 में देखना. अब आप इस ECG को देखो. If you look this ECG, you see lead 1 उन्होंने सिर्फ 3 complexes दिए हुए. AVR के 2 complexes दिए हुए. लीड 2 के ऊपर इन्होंने 3 कॉम्प्लेक्सेस दिए हुए. V1 के इन्होंने 3 से 4. बट ये लीड 2 देखो, यहाँ पे जो नीचे वाली जो ली है, ये पूरी की पूरी लीड 2 है. देखो अब उनकी सेटिंग्स होती हैं, कोई भी लीड इस पे रख सकते हैं, इसमें कोई ऐसी नेसेसरी नहीं है. आपको एक्चुअली जो भी लीड देख रहे हो उसको लंबाई में देखना है.
आप ताकि बिल्कुल एग्जैक्टली रिदम को असेस कर सको। अब देखो 2 और 3 की कॉम्प्लेक्सेस आ रही, डू यू थिंक कि आप उसमें प्रॉपर रिदम पिक कर सकते हो? यू कैन नॉट। बाज दफा रिदम आगे जाके प्रॉब्लम हो रही है या बहुत देर से प्रॉब्लम आ रही है, मिस बीट्स हो रही हैं, तो अगर 2-3 कॉम्प्लेक्सेस अगर आप देखोगे तो आपको कभी भी पिक्चर आइडिया क्लियर नहीं हो। So that is why you should see the bottom of your ECG and you see whatever the lead is over here. It does not matter. These are called long leads and most of the time it is the lead 2. So you see over here, it tells you not only your rhythm but also the rate. So now it is clear that you will going to look for the long leads. Second thing, lead 2 is there. So how you going to calculate the rate? So for the rate, but just remember this formula. I put in this slide 2 formulas because I want to show everything which is relevant to this thing. But for your remembrance, make the things easy. Okay, so how you're going to make the things easy? You will going to see the number of, you will going to calculate the number of big boxes between 2 R waves, between 2 R waves. So you can see this ECG is in front of you. And you see over here, this is 1 R wave, and this is the second R wave. This is the 1 R wave, and this is the second R wave. So you should calculate the distance. And you see how you're going to calculate the distance? You will calculate the large box. So this is the 1 large box, this is the 2 large box, and this is the 3 large box. So basically, it contains 3 large boxes, 3 large boxes. So how you calculate the rate? The numerator should be 300 divided by 3. The answer is 100. So the rate is 100 beats per minute. So is it clear to everyone? This rule is for regular rhythm. Please remember, this rule is for regular rhythm. Okay? Regular rhythm. So what you're going to do, simply you take 2 R waves, and calculate the big boxes, the big box 1, 2, and 3. Just write 300 divided by the number of boxes 3, and the rate is 100. Okay. What you will going to do for irregular heart rate? This rule is only for your regular rhythm. If your rhythm is not regular, so this is the repetition. But I want to add one thing. What I am going to add one thing because that is important for irregular. We have already discussed one large box. This is the one large box. It contains 5 small boxes. 5 small boxes is equals to 0.20 seconds, or you can say 200 milliseconds. The thing is same. So for a 1 second, you should have how much boxes in your ECG? For 1 second, you should have 5 large boxes makes 1 second. If you multiply 200 with the 5, it will equal to 1000 millisecond, which is equals to 1 second. Okay? So you need 5 boxes to make the rhythm 1 second. So 1 second के अंदर कितने boxes आते हैं आपके? 5 large boxes आते हैं. Maybe this calculation at this moment it is seems difficult, but when you practice for your exam, you will going to use it. Okay, so get used to it. So this is very good picture which shows you that one small box is equals to 0.04 second. When you multiply 0.04 with the 5 small boxes, it will be equals to 0.2 second. And when 0.2 may you will going to multiply by 5, the 5, it will make a 1 second strip. So this 5 boxes is equals to 1 second strip. If I ask you, doctor, मुझे कितने second की strip चाहिए? मुझे 6 seconds की strip चाहिए. तो can you give me the answer कि 6 seconds की strip के अंदर कितने large boxes होंगे? Yes. Anyone can answer. Quickly. 6 seconds चाहिए. 1 second में मैंने आपको बता 30. Very good. How you calculate the 30, doctor? Very good. These are very good.
Ma'am,
How you calculate the 30?
As 1 contains 5,
Mhm.
so we multiply 5.
वेरी गुड, वेरी गुड। सो जितना सेकंड चाहिए था हाफिजा ने सिंपली उसे मल्टीप्लाई कर दिया 5 से, क्योंकि उसे ये बात पता थी कि 1 सेकंड में 5 है। तो अब उसको अगर 6 सेकंड्स की स्ट्रिप देखनी है तो वो कितने बॉक्सेस उसमें होंगे, 30 लार्ज बॉक्सेस को वो देखेगी। ठीक है, अगर 10 सेकंड की स्ट्रिप देखनी है तो 10 को मल्टीप्लाई करेगी 5 से, और कितने बॉक्सेस उसमें आ जाएंगे, 50 लार्ज बॉक्सेस आ जाएंगे। ठीक है, लार्ज बॉक्स आपका पूरा ये वाला है जो मैंने कलर्ड किया है, देख लो ग्रीन से, ये 1 लार्ज बॉक्स की आई एम टॉकिंग अबाउट। व्हाई आई एम टॉकिंग अबाउट सो इन डिटेल, because now how you going to calculate the rate for irregular rhythm, because for that we are making this concept. So for irregular rhythm you have to count, just make it very very clear, you have to count R waves, और आर वेव कितने में काउंट करनी, 6 सेकंड की स्ट्रिप पे काउंट करनी। तो 6 सेकंड की स्ट्रिप में कितने बॉक्सेस होंगे, 30 लार्ज बॉक्सेस होंगे, और 30 लार्ज बॉक्सेस में आपने नंबर ऑफ आर वेव्स आपको चाहिए, नंबर ऑफ आर वेव्स चाहिए। ठीक है, और नंबर ऑफ आर वेव्स को आप मल्टीप्लाई करोगे, आपके नॉर्मली 1 मिनट के अंदर, आपके 1 मिनट के अंदर कितने सेकंड्स होते हैं, 1 मिनट में आपके 60 सेकंड्स होते हैं। तो आपने जब 6 सेकंड्स की आर वेव काउंट करी, उसको आप मल्टीप्लाई कर दोगे 10 से, तो वो बन जाएंगे 60 सेकंड्स, और विच विल बी इक्वल टू 1 मिनट। क्लियर, clear everyone?
Yes,
So
ma'am.
let's,
Yes.
okay, let's practice this thing. Okay, maybe you find it difficult at this time, just practice it. Okay, so I have another slide for irregular heart rate. Okay, just see over here. If your rhythm is not regular, if your rhythm is not regular, you can see over here, the first thing what you will going to do, you will take the 6 second strip. So how I take the 6 second strip, if I count for your convenience, I'm counting it. So you can see in this ECG that this is the 1 box, this is 2 box, 3 box, 4 box, 5 box, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30। ठीक है, तो ये पूरी की पूरी कितने की स्ट्रिप उसने ली थी, 30 की ली थी। और मैंने आपको काउंट करके बता दिया कि इस तरह आपने 30 लार्ज बॉक्सेस काउंट कर लिए। अब आप उसमें गिन लें कितनी आर वेव्स आ रही है, ये 1 आर वेव, 2 आर वेव, 3 आर वेव, 4 आर वेव, 5, 6, 7, 8. So total you have 8 R waves in 6 seconds. 6 seconds में आपको कितने seconds की चाहिए, 60 seconds की चाहिए। आपने 10 से उसको multiply किया and you will give the rate 80 beats per minute. Okay, 8 beats जो थी वो 6 seconds में थी, और 80 beats per minute is your answer. Okay, अच्छा अब मैं इसकी एक एग्जांपल करवा देती हूँ। लेट सपोज करते हैं दिस इज अगेन 6 सेकंड स्ट्रिप है, जस्ट कंसीडर इट 6 सेकंड, आई डोंट वांट टू काउंट इट बिकॉज वी हैव अ लैक ऑफ टाइम, तो जस्ट थिंक दिस इज इरेगुलर, कंसीडर इट इरेगुलर। तो कोई भी मुझे जल्दी से इसका रेट बताए कि ये इरेगुलर है और ये 6 सेकंड की स्ट्रिप है, तो व्हाट इज द रेट इन दिस, व्हाट इज द रेट? यस,
100.
Yes, ma'am.
very good.
100.
Very good. So it's simply she count the 1, 2, 3, 1, 2, 3, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, उसने 10 काउंट किया, उसे पता है 6 सेकेंड है, मल्टीप्लाई किया 10 से, इट इज 100। वेरी गुड, ठीक है। सो ये आपको थिंग्स क्लियर हो गई कि अब आपको किस तरह जो है वो रेट जो है वो इरेगुलर रिदम का निकालना है। Now we talk about rate we have discussed. Okay. Third, now we talk about axis, which is very important part. And students find this also a difficult, and we will trying to make it easy. Okay. So cardiac axis, what do you mean by, what is the definition of cardiac axis? Cardiac axis ki definition, definition is that it is basically the overall direction of the ventricular depolarization in the frontal plane. अगर आप हार्ट को बिल्कुल फ्रंट से देख रहे हो तो ओवरऑल डायरेक्शन जो है वो क्या है। तो फॉर एग्जाम्पल इफ यू सी दिस पिक्चर, So normally जो heart अगर आप देखो तो your please share record also. Yes, Dr. Kurat, we will going to share it. Don't worry about it. We'll share it on for everyone. Don't worry. So you can see the heart over here. The normally left side of the heart is your prominent. Okay, left ventricle is thick as compared to the right ventricle. So the more stronger when forces are on your left side. Okay, on towards the left ventricle. Okay, so the direction in the normal heart, you can say it is somewhere over here. So this is in the frontal position. If you see the heart from the front, you can see the chest, and this is your heart lying in front of the chest. So the direction is in this direction. But what happened when there is either the left ventricular hypertrophy occur or right ventricular hypertrophy, the overall the direction of the current you can see changed, completely changed. So for the right, it will goes towards the right ventricle. Okay, it goes towards the right side. And for the left ventricle, it goes slightly in an upward direction. You can see it was in over here, and now it goes in the upward direction. Okay, so how you going to talk all these in properly? How you will diagnose these in on the ECG? For ECG, you should know this. This is a very good, this is a very good a circle, or you can say the figure, which will tell you about the cardiac axis. And you can see, I've already told you about the leads. So for axis, cardiac axis, the most important leads which you will going to look for cardiac axis, the most important leads which you will going to look is, first of all, is the lead 1 and lead AVF. You have to remember it. So try to remember, 1 is for your axis, lead 2 is for rhythm and for your rate, lead 2, okay? And AVF is again for your axis. So one by one, we will going to learn which things for which lead, okay? So 1 and the AVF. So now where is the lead 1? So if you see this diagram, that the lead 1 is on which side of your limb? Where is the lead 1? It is not mentioned over here, but normally लीड 1 की जो डायरेक्शन है वो किस तरफ है आपकी, उसकी मैं ये जो डिफ्लेक्शन आती है ना आपके पास, जस्ट मैं आपको आगे वाली पिक्चर ये देखें, ये इन्होंने लीड 1 यहाँ पे बताई, ठीक है? तो ये लिम्फ लीड्स आपकी टोटल 4 लिम्फ लीड्स थी, ठीक है? बट लिम्फ लीड्स किस तरह बन रही हैं? आपके पास जो एक होती है जो राइट लिम्फ पे होती है, ये ग्रेविटी के लिए, ठीक है? तो ये ग्रेविटी को न्यूट्रलाइज करने के लिए होती है, ये पार्टिसिपेट नहीं कर रही होती, ठीक है? सो राइट आर्म को जो आप लीड लगाते हो लेफ्ट आर्म के साथ, तो लीड 1 की डायरेक्शन इस तरफ होती है, वो हार्ट को इस तरह से देख रही होती है, ठीक है? बिल्कुल 0 डिग्री में देख रही होती है, ठीक है? कहाँ देख रही होती है? हार्ट को 0 डिग्री में देख रही होती है। राइट साइड से लेफ्ट साइड की तरफ का लुक होता है। समझे कि कैमरा जो है वो इधर है, ये दिस इज योर कैमरा, और वो हार्ट को इस तरह स्ट्रेट हॉरिजॉन्टल डायरेक्शन में देख रहा है, तो ये लीड जो है वो 0 डिग्री बनाती है, ठीक है? तो अगर आपकी करंट जो है वो इस तरफ कहीं होगा ना, इस तरफ कहीं, ठीक है? इस तरफ मैंने बताया, अगर आप यहाँ का एक परपेंडिकुलर ड्रॉ कर ले, ठीक है? तो अगर आपका करंट इधर कहीं भी हो, चाहे अपवर्ड हो, बिलो हो, लेकिन अगर इस साइड की तरफ होगा, लेफ्ट साइड की तरफ होगा, तो उसमें आपको लीड 1 के अंदर पॉजिटिव डिफ्लेक्शन मिलेगी। Positive, when you get the positive deflection, when the current is moving towards the lead, towards the direction, current की direction अगर towards the lead होगी, तो it will give you positive deflection. अब lead 1 की direction is in the left side, 0 पे, and if the current is going over here, or if it is going over here, then you can see the perpendicular, you make this in this direction, and if your current is going against it, against the lead, so it will give you negative deflection. It will give you negative deflection on your ECG. So if you make the thing simple, let me make it again a very clear, to make it clear. So how you going to see, आपने ECG lead 1 याद रखनी, ये 0 एक्सिस पे है, लीड 1 का परपेंडिकुलर ऊपर और नीचे बना दिया है, ठीक है? ऊपर और नीचे बनाने के बाद ये वाला जो पूरा जोन है, इसमें कहीं पे भी करंट लाई करेगा, चाहे इधर लाई करे, चाहे इधर लाई करे, लीड वन विल गिव यू पॉजिटिव डिफ्लेक्शन. बट इफ योर करंट इज गोइंग ओवर दिस, इस साइड के ऊपर अगर है, ये इसकी राइट साइड की तरफ है, तो कहीं पे भी हो, इस जोन में हो, इस जोन में हो, it will give you negative deflection. Okay, so please very clear it. Second lead which you will look, if you see over here, AVF. Okay, so lead 1 is important, AVF is important, and third lead is lead 2. So just see first the lead 2, but the top most important is lead 1 and AVF, and I'll explain you why lead 2 is important. So if you see the lead 2 ki jo direction hai, lead 2 ki direction is going in the downward direction from your left arm towards your left limb. It's going in this direction. Okay, so this direction if it is going, so agar aapki ye aapki zero axis hai, theek hai, और आपकी लीड 2 की डायरेक्शन उन्होंने बताई है कि ये डायरेक्शन पड़ती है, ठीक है, इस तरफ आ रही है, ठीक है, लीड 2 इधर आ रही है, टुवर्ड्स योर लेफ्ट लेग, टुवर्ड्स योर लेफ्ट लिम्ब. ओके, बस अभी आप इसको याद, इतना ही याद रख लें, ठीक है, फिर हम इससे इंपॉर्टेंट बात करें. अब एवीएफ को भी हमने डिस्कस करना है. एवीएफ को हमने क्या डिस्कस करना है? एवीएफ हार्ट को किस तरह देख रही होती है? एवीएफ बिल्कुल वर्टिकल डायरेक्शन में देख रही होती है, 90 डिग्री पे, ठीक है. आपने अब तक डिस्कस किया कि एक्स एक्सिस पे आपकी लीड 1 देखती है और वाई एक्सिस पे परपेंडिकुलरली एवीएफ देख रही होती है, ठीक है. एवीएफ आपको फ्रॉम द हार्ट को बिलो से देख रही होती है, नीचे से देख रही होती है, ठीक है. अब ये वाली इसकी पोजीशन है, ठीक है, ये इसकी वर्टिकल पोजीशन है. अगर आप इसका परपेंडिकुलर बनाएं, जस्ट मेक द परपेंडिकुलर विद रेड, इसका परपेंडिकुलर इस तरह बनेगा, ठीक है. परपेंडिकुलर ऑलवेज लाई ऑन 90 डिग्री. तो इसकी डायरेक्शन अगर वर्टिकली है और आपने परपेंडिकुलर यहाँ बनाया, तो कोई भी डायरेक्शन ऑफ करंट इन दिस हेमिस्फीयर मींस इन द डाउनवर्ड डायरेक्शन, if the current is over here or over here, it will give you positive deflection because it is in the direction of the lead 2. But if the current position is in this direction, in the above hemisphere, then the AVF, it is against the AVF. AVF is looking in this direction, and current, if the current of the heart is going in the upward, then what you're going to see in the leads, you see the negative deflection. Okay, is this clear? Is this clear to all? तो आपको दो चीजें देखनी है, लीड 1 एंड लीड एवीएफ. ओके, सो व्हाट इज द नॉर्मल एक्सिस? अगर आप इस हेमिस्फीयर को अगर आप कैटेगराइज करें सिंपली, अगर आप एक अपना सर्कल बना लें, ठीक है, खुद से, और उसमें दो तो आप खुद से लिख दें कि ये 0 डिग्री है, ये 90 डिग्री है, ठीक है. तो आप इसके बाद ज़ाहिर 0 से 90 है, तो ये वाला आपका पॉजिटिव साइड है, तो ऊपर वाला क्या हो जाएगा? -90 हो जाएगा, ठीक है. ये 0 है तो ये 180 हो जाएगा, सही है. अगर आपका ये वाला जोन -90 है, तो ये होगा -10, -20, -30, ठीक है. ये इस डायरेक्शन में आप उसकी नंबरिंग करेंगे. तो आपका जो नॉर्मल एक्सिस है, ये आपको याद होना चाहिए, जो कि पिंक शेड्स में बना हुआ है. नॉर्मल एक्सिस इज लाइंग बिटवीन माइनस, समटाइम दे आस्क, it is for your task paper, they ask in the degree, but for AKP they do not ask in proper in degrees, but if they are giving in the degrees, you should have an idea. Okay, if it is in between -30 to +90, if it is lying between -30 to +90, just a second. Okay, I'm back. So what I told you that the normal axis should between minus 30 to plus 90. Okay, minus 30 to plus 90, you should remember it. It is lying in this direction, minus 30 to plus 9. Plus 90 onwards. See if your value is in plus 90 onwards, it shows you right axis deviation. Okay, and if your value in the negatives, you see the region from minus 30 to minus 90, which is shaded with the green color, it tell you left axis deviation. Okay, so right axis is complete this side. So if it is up to 80, 180, it is right axis. If it is beyond 180 to minus 90, the yellow shade is tell you extreme axis deviation, extreme right axis deviation, also called it. So for simpler, what they made you, if it is more than plus 90, it is called right axis. If it is beyond minus 30, it is called left axis. The normal range is minus 30 to 90. Okay. Now we see how you're going to, I've already discussed, if the direction of the current is going towards the lead, it will give you positive deflection. So positive deflection is shown by the R wave, and the negative deflection is shown by S wave. So how you can say if this lead is positive or negative? It is the length of the R and the S which will tell you about whether it lead is showing positive or negative. If the R wave is more, or if the R wave is larger than the S wave, means more positivity compared to the negativity, overall you will going to take this lead as a positive. Because what happened if the lead is clear cut only R, then it is very easy that it is positive. But if it is like this, it is very difficult to say whether you take it positive, negative, isoelectric, you confused it. Okay, so it is a more positivity, that means you conclude it as a positive. If it is more negativity as compared to the positive R wave, you say simply it is a negative. When the direction is same, you say it is equiphasic, it is isoelectric, and you cannot comment it whether it is fully positive or fully negative. You say it is a isoelectric. Okay, so now look at with ECGs. Now we're going to make the things which we have discussed. Now we're going to make them practical. Okay, so this is the ECG in front of you people. Okay, and in the ECG you can see first two leads. First try to make the rule कि हम start करेंगे with two leads. So what I told you, the first lead you will see is the lead 1. So this is your lead 1. Okay, so let me okay, lead 1, and the second lead which you will going to see is your lead 2, lead AVF. I'm so sorry, lead AVF. So where is the AVF lead? You can see this is the AVF lead. Okay, so you have seen these two leads, and now once you have see these two leads, you will see overall the direction. So in lead 1 you have full R wave, full R wave. That means lead 1 is positive. Okay, so if lead 1 is positive, let me draw my diagram. So if you have a problem, just make the diagram of sphere and make 4 quadrant. You have make the 4 quadrant. Now you have seen the lead 1 is completely positive. If lead 1 is completely positive, means you have an idea that if it is lead 1 positive, that this whole region is for positivity. यहाँ कहीं पे भी करंट हो, चाहे ऊपर हो चाहे नीचे हो, बट अगर इस पूरे क्वाड्रेंट के अंदर है करंट कहीं भी, it will show कि it will show on the ECG as a positive deflection. तो ये मुझे कंफर्म हो गया कि ये पूरा जोन जो है ऊपर से यहाँ से लेके यहाँ तक it is completely positive. Now I see AVF. So what I see in the AVF lead, again AVF lead, if we see this AVF, again it is more positivity as compared to the small S wave. The small S wave, it means that the R wave is larger than the S, so it is positive. If it is positive, then we all know that this looks in the downward direction, plus 90. And I know that for positive in AVF, the current should be somewhere over here, in whole this below this hemisphere. Okay. So what is the axis? Doctor, why you make this? So wherever the both of these leads you can say intersect or meeting in this region, you can say that they are coinciding, or they are, you can say over here, both are having the direction in this quadrant. Okay, they are what you say, दोनों इस जगह पे मिल रही हैं, आप merge हो रही हैं, you can say. So the direction is decided that it is in this quadrant, and we know that this is positive, this is 90. So current is somewhere in 0 to 90 because both are coinciding in this region. So 0 to 90 is your normal axis. So for simplification, you say if both leads are in a positive direction, lead 1 and AVF, if both are in positive, and we also say that double thumb up. So if you take lead 1 as a right thumb and AVF as your left thumb, so if you both thumbs up, just for, thumb up, that you want to say, okay, good, well, both thumbs up, that means this is normal, this is okay, perfect, it's a perfect axis. Okay, it's the normal axis. Okay, is this clear to everyone? Clear or not? Very good, Sumbal. Okay, thank you for commenting. Okay, now we talk second. Second, अब हमें क्या देखा? Again, ECG से start करते हैं. We start with lead 1 and lead AVF. So again, what we discussed that हम A1 और AVF को सबसे पहले locate कर लेंगे. We have already located. This is your lead 1. This is your lead AVF. Okay. So if you see the lead 1, in this lead 1, you say the deep S waves are there. This is the deep S waves. And deep S wave means it is negative. Lead 1 is at this time, it is negative. So what I told, first make your hemisphere like this. Okay. In this direction, this is your positive for lead 1. And this is negative for lead 1. So if you make the perpendicular like this whole region is negative for lead 1. Okay, you have made it. Okay. Now you see the AVF. AVF is R wave. Okay, so already I told you that R wave is, AVF is in the downward direction. So if it is positive, more R wave, then the direction of the current should be over here. And where both lines are intersecting, the region is from plus 90 to 180. It is beyond, it is more than 90 degree. That means this is right axis deviation. If it is more than 90, if it is in this region, this is called right axis deviation. Is it clear to everyone? So for right axis deviation, as I told you, the right of the thumb, the right side, you can say lead 1. First lead is your right thumb. Right thumb, if it is going down, make the right thumb down, down, down. Lead 1 down. That means it is right-sided deviation. Right side. So the lead 1 will going in the downward direction, and the AVF, your left thumb, would be in upward direction. So right thumb goes down. This is called right axis deviation. Okay. So anyway, which it is easy for you. Some people think this thumb method easy. Some people think this, making this circle easy. So whatever, because in exam, you should have an alternative strategies. Why? Because sometimes the common things also comes out from your mind. So sometimes you become confused in the common things. So that's why you should have a way to, figure out that problem. Okay. Now, next, left axis. So what for the left axis? I'll give you the practice as well. Okay. So just left axis, first what I told you, for left axis and normal axis. Now the problem arise. What's the problem arise, doctor, in this session? See, what I told you, if you see this quadrant, if you see, I have this quadrant over here. In this quadrant of the circle, let me draw it. Let me draw it. In this quadrant of the circle, the upper quadrant, this quadrant I'm talking about, it has two things. What two things? The pink shaded area from 0 to minus 30. 0 to -30 has a normal value, and from -30 to -90 it is left axis. Okay, so is in this area you have a confusion. Okay, so first start. Okay, then we solve this confusion as well. So what we're going to do, we look at the lead one. Lead one has a very small QRS complexes, but if you see the R wave is the most prominent among them, so you take it lead one as a positive. So just make your diagram, and this is your positive side, this is your negative. So in the circle, this whole is your positive. Okay, you make it positive. Then what happened? You go for early AVF. If you see the AVF is in negative side. AVF is in the negative side. So you know the AVF, the plus 90 is over here. So this whole side is for positive, and above the hemisphere is for negative. So as the lead is negative, this whole side is negative. And where both lines are merging or intersecting, the region is this. So now the question is whether this is left axis or this is normal axis. Okay, because in this quadrant you have both. From 0 to -30 the normal axis, -30 to -90 you have a left axis. For this confusion, now you will going to concern lead 2. Now you will going to concern lead 2. Please come and solve our problem. Please lead 2, come and solve our problem. So you all know that lead 2 की जो direction है towards left limb, it was the normal axis की direction में lead 2 जा रही. So what you will going to see, if the lead 2 में positivity है, if the lead 2 has positivity, that means the axis जो इस quadrant में आपको मिल रहा है, it is in this region. If the lead 2 is positive, it indicates ये normal axis का part है. If your lead 2 की negativity जाओ तो वो upward जाएगी. ठीक है, if you got perpendicular in a upward direction, आप इसका ये perpendicular इस तरह बनाएं. ठीक है, तो ये सारे रीजन के अंदर परपेंडिकुलर का पॉजिटिव है और ये सारे रीजन के अंदर नेगेटिव है. सो इफ द लीड 2 हैज अ नेगेटिविटी, देन यू से कि ये जो एक्सिस है जो इस क्वाड्रेंट में लाई कर रहा है, दिस इज लेफ्ट एक्सिस डेविएशन. सो व्हाट आई सी इन द लीड 2, in the lead 2 you got complete negative. So the lead 2 direction is this. Let me clear it again. Lead 2 की direction यहाँ है. You make a perpendicular like this. Toward this you have positive, and above it you have negative. So negativity is lying in the left axis deviation column. So if lead 2 is negative, it is confirmed that it is lying in the left axis deviation. Is this clear to everyone or not? Why you are using lead 2? Clear or not? No? Clear hai pakka? Chalo, that's great. Now we're going towards the extreme axis deviation. So what we are going to find in the extreme axis deviation, so start from the lead 1 again. So the lead 1 is completely negative. So just make a circle like this. This is the positive, this is the negative. The current is somewhere lying in this region. Then you see the AVF, and if you see the AVF over here, where is the AVF in this ECG? This is over here. This AVF, this AVF, AVF. So AVF is also in the negative. So AVF negative means in an upward direction. So both are coinciding in this region. That shows this is extreme. So extreme mein both thumb will be going down. Both thumb will be going down means this is completely poor, very bad situation. Extreme axis deviation. Okay. अच्छा, एक और चीज आप लोग अपनी बुक्स में पढ़ते होंगे, सुपीरियर एक्सिस. व्हाट डू यू मीन बाय सुपीरियर एक्सिस? तो जो आपका लेफ्ट एक्सिस होता है उसी को आप क्या कहते हैं? लेफ्ट एक्सिस का सेकंड नाम क्या है? सुपीरियर एक्सिस है. And when you get superior axis is a characteristic ECG finding for the primum is ASD primum. Okay, this is characteristic for the ASD primum. This is left axis deviation or called superior axis.
ठीक है और उसके साथ साथ जो हमें जो लड़का था ताबीर जो लड़की है उसका नाम नहीं मिल
Okay, so now this is again the summary which we have discussed up till now. This is all the summary which I have discussed it. So just go through it in a quickly. For normal, both thumbs up. For I'm so sorry. For normal, the both thumbs up, and for abnormal, completely abnormal, extreme axis, the both thumbs are in a downward direction. For right axis, I told you the lead 1 in the negative. Superior axis means, doctor, left axis. See, so left axis deviation ka another name superior axis, and superior axis you found in ASD primum. Okay, primum ASD. You have two types of ASD. So I'm talking about the primum category, which is close to the AV node. Okay. Okay. Next we are talking about. Okay, doctor. So if the left thumb goes down, that most likely AVF goes down. This is left axis. But for left axis, you have to see the lead 2. If lead 2 is in positive, two things are positive, go for the normal. If 2 is also negative, then it basically confirms that this is left axis deviation. Now we go for the practice ECGs. Okay, so this is the ECG. And who will going to tell me about this? Quickly, anyone can, come up with the answer.
Normal axis.
Normal.
Very good. Very good. Both are thumbs up. Lead 1 and lead AVF. Very good. So it is normal. Very good. So what about the other things? Rate rhythm. So if you see the rhythm is okay. You cannot comment on the rhythm. Doctor, you do not have a lead 2 की current की direction. Lead 2 सुनो गौर से सुनो देखो दो चीजें पॉजिटिव हों तो समझो नॉर्मल है दो पॉजिटिविटी आ रही है तो नॉर्मल है ठीक है सो लीड 2 भी पॉजिटिव मिले लीड 1 भी पॉजिटिव मिले दैट इज नॉर्मल सिर्फ एवीएफ नेगेटिव है एवीएफ भी नेगेटिव आ रहा है लीड 2 भी नेगेटिव आ रहा है दो नेगेटिविटी नॉर्मल नहीं हो सकती प्लीज रिमेंबर लाइक दिस थिंक अबाउट लेफ्ट एक्सिस ओके अच्छा तो हम इस पे रेट रिदम पे क्यों कमेंट नहीं कर सकते बिकॉज डॉक्टर यू डू नॉट प्रोवाइड मी द लॉन्ग स्टेप ओके तो नेक्स्ट मूव ऑन ये ईसीजी में बताएं क्या है एक्सेस जल्दी से
राइट
एक्सेस डेविएशन
क्या बात है भाई माशाल्लाह वेरी गुड सो लीड 1 राइट नेगेटिव 1 राइट नेगेटिव वेरी गुड इफ यू टॉक अबाउट दिस ईसीजी
लेफ्ट डेविएशन
वेरी गुड सो आपने फौरन देख लिया कि दो नेगेटिविटीज आ गई लीड 2 में भी नेगेटिविटी है एवीएफ में भी नेगेटिविटी है सो इट इज लेफ्ट एक्सिस डेविएशन वेरी गुड दिस ईसीजी
नॉर्मल
राइट एक्सिस डेविएशन
क्या कह रहे हो
राइट एक्सिस डेविएशन वो नॉर्मल एक्सिस
see positivity 1 positivity both positive thumbs up this ECG
ये राइट एक्सिस
this is right axis deviation okay this ECG
लेफ्ट एक्सिस डेविएशन
लेफ्ट
पॉजिटिविटी
लेफ्ट एक्सिस
पॉजिटिविटी ज्यादा है कि नेगेटिविटी ज्यादा लीड 2 में देखो
नेगेटिव
लीड
है
2
ना
में कंपैरेटिवली पॉजिटिविटी ज्यादा है ठीक है स्मॉल सी एस वेव है आर वेव कंपैरेटिवली ज्यादा है तो इफ टू पॉजिटिव
cannot be differentiated here
क्या चीज
मैम दोनों एक जैसी आ रही ना ऊपर भी मतलब वेव की समझ नहीं आ रही
हाँ
up
तो
ज्यादा
इतनी
है, down।
नेगेटिविटी स्ट्रॉन्ग नेगेटिविटी तो नहीं है ना सो यू कैन नॉट से लेफ्ट एक्सिस ठीक है ना अभी आप इसको नॉर्मल एक्सिस ही कहो और लेफ्ट एक्सिस द नेगेटिविटी शुड बी क्लियर कट ओके तो इट्स नॉट आइसोइलेक्ट्रिक मिल रही है या फिर आपको पॉजिटिविटी ज्यादा मिल रही है So go for the normal axis. So it would again in a direction of the normal. Okay. Okay. Now we talk about the waves. We have discussed the four things: the calibrization, the rhythm, the rate, and the axis. Now we talk about the waves. And I think maybe we are unable to finish waves today because there is another class at 10. So we just try to finish cover maximum by 10. Okay. So start with the P waves. So what is the significance of the P waves? So P waves, ke liye which lead you will going to look. For lead 2, you will going to see for P wave. Okay. So lead 1, axis. Lead 2, rhythm, rate, and for P waves. Okay. And okay. So lead 2 is looking for, so what is the normal for a P wave? You will see both things in a vertical direction as well and in the horizontal direction. Both have a significance. Okay. So just remember one thing, you'll be confused with two things. So many things are for the exam. Just remember lead 2. So what you see, if normally, what is the length? So normally, if you want to remember the length, learn 2 by 2.5 into 2.5. Just make the life easy. So the length should be 2.5. You can say the speed or the width, both things. This is the speed or the width. So it should also be in a 2.5. Okay. So the general rule is 2.5 boxes, small boxes I'm talking about. Okay. 2.5 small boxes in a upward, 2.5 small boxes in a horizontally. This is the normal. Okay. So if it is more in either in a vertical direction or in the horizontal direction. So if it is in a vertical direction, you can see if it is, tall. If they are tall, vertically, if they are tall, it tells you about right atrial enlargement. But if they are wide, more than 2.5 boxes, it tells you about left atrial enlargement. And you see in the picture that if you have both the right and the left, both atrium are enlarged, then the wave would be tall and the wider, both. Okay. So for make it simple, remember the word 2.5 small boxes. If it is more than 2.5 small boxes vertically, it is right atrium. If it is more in a horizontal direction, it is left atrial enlargement. Okay. This is simple for P wave. Now take this example and see what is the problem in this P wave. Can you appreciate the problem in this P wave? Clear cut. Okay. So this P wave is, yes. So how many boxes it almost contain? 3 boxes. Clear cut 3 boxes you can appreciate over here. It contains 3 small boxes and it is more wide. So that is why it is P mitral and it shows you that it is left atrial enlargement. Okay. So what this ECG is telling you, for what you will going to see in this ECG. Did you find any abnormality in this ECG related to the P waves?
This is tall peaked P wave. Tall P. It occurs because of the right atrial hypertrophy.
Very good. So all do not remember all. Make a habit. P wave आपने देखनी lead 2. ठीक है. P wave का आपका axis क्या होता है? वो हमेशा वो भी positive होता है. ठीक है. Normally आपकी जो P waves होती हैं, वो उसकी जो lead 2 में ही आप axis देखते हैं. P wave का axis भी आप अगर देखें, normally तो आप QRS का axis देख रहे होते हैं. ठीक है. लेकिन P wave अगर आप normally देखें lead 2 में, वो upright मिलेगी आपको. ठीक है. Downward नहीं होगी. Upright होगी और ये taller है, so it shows right atrial enlargement. Okay. So this is related to we are talking about waves. We will interval we will discuss later. So 3 waves basically we will going to cover. First we say the P and now we talk about QRS complex. Okay. So QRS complex may you have to see 2 to 3 things, but over here, first we will going to cover in this is the QRS, you can say the speed of the QRS complex. Okay, narrow QRS complex, and you can see the wide QRS complex. And when you will going to label it wide, again the normal QRS की जो length है, normal इसकी भी 2 to 3 small boxes है. So word P wave के लिए भी आपने 2.5 याद रखा, तो for QRS के लिए भी आप 2 to 3 याद रखो. ठीक है, so 2 to 3 small boxes जो है वो आपके normal QRS complex है. ठीक है, so if it is narrow from 2 से भी अगर आपका कम हो रहा है, less than 100 milliseconds है, एक बॉक्स जो है वो 40 milliseconds का था. We have already discussed. 2 boxes 80 के हो गए, तो 80 जो है 80 to 100, so 100 याद करना मुश्किल है, तो just make it 2 to 3. तो 2 से ज्यादा कम अगर आपके बॉक्सेस हैं, दैट मीन्स कि ये नैरो कॉम्प्लेक्स. और नैरो आप इजीली अप्रिशिएट कर सकते हो इस पिक्चर में, कि आप इजीली आइडेंटिफाइड कर सकते हो. और नॉर्मल क्यूआरएस कॉम्प्लेक्स जो होते हैं, जो आपकी नॉर्मल ईसीजी होती है, उसमें भी आपको नैरो ही कॉम्प्लेक्सेस मिल रहे हैं. ठीक है, बट इफ इट इज वाइड, वाइड क्या हो गया कि आपके मोर देन 3 बॉक्सेस हो गए. 120 milliseconds मीन्स मोर देन 3 बॉक्सेस हो गए, तो दिस इज कॉल्ड वाइड क्यूआरएस कॉम्प्लेक्स. और जब भी कभी वाइड क्यूआरएस कॉम्प्लेक्स होता है, तो बहुत ही ब्रॉड सी अगर आपने डिफरेंशियल्स बनाने, तो 2 वजूहात है. कौन सी हैं? 2 वजूहात. 2 वजूहात क्या है कि आपका जो है या तो ब्लॉक है, ठीक है, आपके ब्लॉक जब भी होगा उसके अंदर आपको वाइड क्यूआरएस, किसका ब्लॉक? आई एम टॉकिंग अबाउट बंडल ब्रांच ब्लॉक. ठीक है, क्योंकि जो कंडक्शन का जो पाथवे है उसमें अगर प्रॉब्लम है, राइट बंडल ब्रांच ब्लॉक, लेफ्ट बंडल ब्रांच ब्लॉक, मैंने बंडल ब्रांचेस दिखाई थी आपको बिल्कुल शुरू में. ठीक है ना, तो अगर प्रॉब्लम ब्लॉक्स के लेवल पर है, देन इट इज अगेन कॉजेज आपका वाइड क्यूआरएस. और सेकंड, अगर आपकी जो रिदम है ऐसे नोट से ओरिजिनेट नहीं हो रही, बल्कि वेंट्रिकल से ओरिजिनेट हो रही है, वेंट्रिकल में स्कीमिया हुआ है या कोई भी प्रॉब्लम है, अगर वेंट्रिकल ओरिजिनेट कर रहा है, तो वेंट्रिकल अगर ओरिजिनेट करेगा रिदम, तो वो किस तरह स्प्रेड होगी पूरे वेंट्रिकल में? वो स्प्रेड होगी थ्रू मसल्स, क्योंकि वो तो पाथवे से नहीं स्प्रेड हो रही. तो जब मसल्स के थ्रू वो स्प्रेड होगी, इट टेक्स टाइम. सो दैट इज व्हाई यू हैव ब्रॉड क्यूआरएस कॉम्प्लेक्स if the origin is from your ventricle. ऐसे नोट के बजाय वेंट्रिकल से जो है वो ओरिजिन हो रहा है. ये 2 बातें क्लियर हो गई आप लोग को? क्लियर है यहाँ तक कि नहीं क्लियर है?
यस यस.
ठीक है, अब हम बात करते हैं क्यूआरएस कॉम्प्लेक्स. तो जब हम क्यूआरएस कॉम्प्लेक्सेस ब्रॉड देख रहे हैं, तो मैंने आपको क्या कैटेगरीज बताई? कि ब्रॉडली मैंने आपको 2 ही कैटेगरीज बताई, कि आइदर बंडल ब्रांच ब्लॉक होना है, या फिर जो है वो आपका वेंट्रिकल से ओरिजिन होना है. सो अगर वेंट्रिकुलर ओरिजिन है आपका, तो यू विल नॉट गेट पी वेव, यू विल नॉट गेट पी वेव. सो वाइड क्यूआरएस कॉम्प्लेक्स के लिए भी आपको दूसरी चीज क्या देखनी है? पी वेव. पहले किसमें पी वेव देखने का मैंने बताया था? जब रिदम का प्रॉब्लम था, मैंने कहा था जैसे ही रिदम इरेगुलर लग रही है, पहले पी वेव ढूंढो. पी वेव है, साइनस एरिथमिया. पी वेव नहीं है, problem start. So similarly, if you have wide QRS complex and if you do not have P wave, that means origin is from the ventricle. So ventricular origin अगर हो, तो 2 ही जो है वो प्रॉब्लम्स होते हैं, या तो वेंट्रिकुलर फिब्रिलेशन होती है, या फिर वेंट्रिकुलर टैकीकार्डिया होता है. ठीक है, सो ये आपको वेंट्रिकुलर फिब, वी फिब और वी टैक, इसमें आपको ब्रॉड कॉम्प्लेक्स टैकीकार्डिया मिलेगा. And how you're going to differentiate it? The V-tach would be regular, while V-fib would be irregular. So these are the very, simple things to try to make things easy. But if you have a P wave, that means the SA node is originating, but you have a block at the level of your conduction system. So if you have a block, then you have a morphology, like either could be like a right bundle branch block, or could be left bundle branch block. So how you going to, understand is this a right bundle branch block or the left bundle branch block? So it's a very simple mnemonic for that. Okay. So if you see the William word, if you can understand the word William, so remember where you see these blocks, just a second. Where you see these blocks, you will, for block, you will going to see the V1 and the V6. Okay. So for the block, for the bundle branch block, you have to look V1, V2 और V6. ठीक है, आपको एक V6 देखनी है आखिरी और V1 या V2 देखनी है. ठीक है, आपने ये देखना है. और विलियम के में बीच में दो L आ रहे हैं. विलियम, विल, L. So L shows that it is left bundle branch block. So William V, W. So start from W. So you have a W-like pattern in the V1. So you can see clear cut a VW pattern in the V1 and M pattern would going to be in the V6. The word remember for left bundle branch block, it is the word William. And for the right bundle branch block, you have a word marrow. You have a word marrow. So marrow again double R is from the right bundle branch and M pattern you can see in the V1 and the W pattern is V6. And if you see the V6 may you have broad S waves would be there. Okay, so like sometime the pattern could be slightly changed. You can see over here that in the right bundle branch block, what I told you, marrow. So marrow, right bundle, if you see M in the V1 or V2, and you can see in the V5 or V6, you have a W. So you have a broad and deep S. So sometimes the W figure can be like this. In this figure, see the W is like made, I can just make a W like this. You see a very small, this W part, then it's going out. So it's a very small initially, then it's going and you have a deep S wake like this, okay? So deep in S, very small like this, they form this W, okay? So this is a, for left bundle branch block, it's a William. So first is the W, you can see William W and then this M pattern. So you should remember this pattern and now please diagnose this. Diagnose this. What you're going to see and what you're going to observe, just tell me.
M pattern आ रहा है इसमें. Marrow,
किसमें आ
marrow is
Very
right.
V1 में
Yes.
V2 में आ रहा है और V3 में आ रहा है.
Very good. और V6 में क्या आ रहा है?
और
W टाइप पैटर्न है ना, ठीक है ना. V6 का मैंने पैटर्न इस तरह भी एक दिखाया था. ये देखो इस तरह का पैटर्न आ रहा है ना, ये देखो ऐसा पैटर्न आ रहा है ना, ये नोट करो. कंप्लीट W नहीं है लेकिन इसी तरह का ये डीप S टाइप का पैटर्न है. ये वाला पैटर्न देखो थोड़ा सा डीप S है, ठीक है.
जी बिल्कुल.
बट क्लियर कट M आ रहा है आपको, ठीक है. सो दिस इज राइट बंडल और आपका जो QRS कॉम्प्लेक्स की जो विड्थ है वो डेफिनेटली 3 बॉक्सेस को क्रॉस कर गई है, ठीक है. तो ब्रॉड QRS कॉम्प्लेक्स whenever you get it, so if it is associated with P waves, think about this bundle branch blocks and you should see the V1, V2 along with the V6 and you should remember that mnemonic. See this ECG please. Comment on this ECG please.
लेफ्ट बंडल ब्रांच ब्लॉक पहले में W आ रहा है V2
अब
और
आप
V1.
अगर इसके कॉम्प्लेक्सेस देखो डॉक्टर कितने ब्रॉड से ना, इट इज वेरी ब्रॉड है ना, इट्स क्वाइट ब्रॉड. 3 बॉक्सेस को क्रॉस कर रहे, लग रहा है कि बड़े बड़े कॉम्प्लेक्सेस हैं. सो इफ दे आर क्वाइट लॉन्ग, सो आप V1 to V6 देखो तो क्या पैटर्न आपको इसमें लग रहा है. अगर आप V6 को देखो, V6 में कौन सा पैटर्न आ रहा है? M पैटर्न. यू कैन सी ओवर हियर M पैटर्न.
पैटर्न आ रहा है V6 में.
यस, और यहाँ पे इतना क्लियर नहीं लेकिन है ये W ही, मतलब नीचे की तरफ है
पैटर्न
ना.
आ रहा है.
यस, Q पैटर्न आ रहा है, QR पैटर्न आ रहा है. एग्जैक्टली. तो दैट्स व्हाई ये आपका कौन सा ब्रांच हो गया. M अगर आखिर में आ रहा है तो ये क्या होता है? विलियम. M लास्ट में, सही है. तो मोस्ट लाइकली ये क्या हो गया आपका? लेफ्ट बंडल ब्रांच ब्लॉक, ठीक है. अब हम बात कर रहे हैं, अभी हमने वाइड की सारा कॉन्सेप्ट लिया, ठीक है. कि वाइड अगर हमें मिल रहा था तो इधर ब्लॉक था या डॉक्टर ये जो है वो वीफेब हो सकता है, वीटैक. वीफेब और वीटैक की मैं आपको आगे दिखाऊंगी इसी चीज. अब हम बात करते हैं नैरो कॉम्प्लेक्स. जब भी आपको नैरो कॉम्प्लेक्स अब अगर नैरो कॉम्प्लेक्स है, ठीक है, और टैकीकार्डिया भी साथ है, ठीक है. सो मोस्ट ऑफ द टाइम ECG में आपको नैरो कॉम्प्लेक्सेस मिल रहे हैं और टैकीकार्डिया है, तो आपके कितने डिफरेंशियल्स बनते हैं? 4 डिफरेंशियल्स बनते हैं. कितने डिफरेंशियल्स बनते हैं? 4 डिफरेंशियल्स. तो व्हाट आर द 4 डिफरेंशियल्स? ईदर यू हैव साइनस टैकीकार्डिया, either you have supraventricular tachycardia, either you have atrial fibrillation, atrial flutter. तो इन सारी सिचुएशन के अंदर you will going to find out narrow complex. Narrow complex किसको बोलते हैं? QRS complex की they are talking about. It means that जो origin है, जो origin किसका, डेफिनेटली हम बात कर रहे हैं इलेक्ट्रिकल एक्टिविटी का जो ओरिजिन है वो अबव द वेंट्रिकल, वेंट्रिकल से नहीं हो रहा, वो अबव द वेंट्रिकल मींस एट्रियम से। आइदर वो साइनस है, ऐसे नोड बहुत ज्यादा फायर कर रहा है तो साइनस टैकिकार्डिया है, आइदर वो एसवीटी है कि कोई और जो है वो राइट एट्रियल enlargement and right ventricular hypertrophy is not same. राइट एट्रियल enlargement सिर्फ एट्रियम की enlargement बता रही है जो कि आप पी वेव में डिटेक्ट करोगे। राइट वेंट्रिकुलर की enlargement आप आर वेव्स देखते हो V1 के अंदर, उसमें आप V1 लीड देखते हो और उसके अंदर QRS कॉम्प्लेक्स में आपने वेंट्रिकुलर रिलेटेड प्रॉब्लम्स QRS कॉम्प्लेक्स में ढूंढने, एट्रियल रिलेटेड प्रॉब्लम आपने पी वेव्स में ढूंढने। ठीक है, both are different things. So narrow complex tachycardia, either it is from sinus node first, second या SVT का मतलब है कोई और abnormal foci है but वो है above the ventricle. It is not from the atrium, the sinus. It is not from SA node. That is why you do not have P waves. Okay, atrial fibrillation में fibrillatory हो रहा है, पूरे एट्रियम में जगह जगह से फिब्रिलेशंस हो रही हैं, जगह जगह से यू कैन से इलेक्ट्रिकल एक्टिविटी हो रही है और आपको जो है वो एसवीटी और एट्रियल फिब्रिलेशन इन दोनों में पी वेव्स नहीं होंगी। प्लीज गौर से सुने बात, एसवीटी और एट्रियल फिब्रिलेशन दोनों में पी वेव्स नहीं है। हाउ यू गोइंग टू डिफरेंशिएट बिटवीन देम? इट इज ऑन द बेसिस ऑफ रेगुलर है आपकी रिदम या इररेगुलर। So if you have regular rhythm with no P waves, regular with no P waves, it means that this is SVT. If it's no P waves and irregular, it means this is atrial fibrillation. तो atrial flutter कब होता है कि ऐसे नोड में कोई डिजीज हो रही है, दो दफा उसने जो है वो P wave आपकी बनाई है, तो अगर 2 से 3 दफा P wave आ रही और फिर आपकी वेंट्रिकुलर पे रीपोलराइजेशन हो रही है, जैसे हम सॉ टूथ पैटर्न भी कहते हैं, आरी की तरह जो है वो पी वेव नजर आती हैं, दिस इज कॉल्ड एट्रियल फ्लटर। तो सारी ओरिजिनेशन इलेक्ट्रिकल एक्टिविटी की अबव वेंट्रिकल है, दैट इज व्हाई यू हैव नैरो कॉम्प्लेक्स QRS complexes. Okay, so sinus tachycardia, it is very important you see that P wave would be present. So if you see P wave in this direction, in this कि टैकिकार्डिया हार्ट रेट ज्यादा है, ठीक है, लेकिन सारी की सारी प्रीवियसली पी वेव्स आ रही है, पी वेव्स आ रही हैं। तो जब भी आप मॉनिटर पे हार्ट रेट ज्यादा देखते हैं तो सबसे पहले पी वेव्स ढूंढते हैं, साइनस है कि नहीं है, क्योंकि अगर साइनस है तो उसका मैनेजमेंट डिफरेंट है। आपको फीवर को देखना है, सेप्सिस हो सकता है, डिहाइड्रेशन हो सकती है, पेन हो सकती है, इरिटेबिलिटी हो सकती है, एंजाइटी हो सकती है, सारे कॉजेस हो सकते हैं। बट अगर आपको पी वेव नहीं मिल रही तो आपने फौरन अपने आप को जो है वो इरिथमिया सोचने कि किस इरिथमिया में मेरा बच्चा जा रहा है। ठीक है, तो 2 तरह के मैंने बता दिए कि एसवीटी या एट्रियल फिब, दोनों में पी वेव्स नहीं है। हाउ यू गोइंग टू डिफरेंशिएट इन दिस ECG? यू कैन क्लियरली से दैट there is no P waves, only T wave and QRS complexes are there and they are irregular. That means this is atrial fibrillation. So atrial flutter, you can see sawtooth like pattern is there and the QRS complexes would be regular. So it is a regular rhythm, but you have so many P waves, sometimes 2 P waves, sometimes 3 P waves. So the morphology of the P waves would be same. Morphologically, they would be same. So this is a very good chart taken from your SOP book. The how you're going to differentiate between sinus tachycardia and SVT. So if you see the sinus, the heart rate never goes beyond 200, whether the child is there. But if it is going beyond 200, you should be alarming, okay? And in SVT, the heart rate is more than 220, ठीक है? P wave normally upright आपको मिलती है, किस में आप देखते हैं लीड 2, अभी आप याद रख लें, ठीक है? बट उसमें क्या है, P wave absent है या P wave negative मिल रही। So if it is a P wave negative, that means it is not originating from SA node. It is originating elsewhere, maybe near to the AV node. That is why वो negative आ रही, ठीक है? So अगर negative P wave है या absent P wave है, that shows it is not originating from SA node. Beat to beat variability, no beat to beat variability. Okay, so ये beat to beat variability क्या चीज है? It is related to your heart respiration. कि respiration के साथ आपका beat का difference होता है, जिसे हम sinus arrhythmia कहते हैं. SVT हमेशा regular होता है, fixed RR interval है, no relationship with the respiration. हार्ट रेट स्लो विद रिसेसिटेशन, तो उसमें ट्रीटमेंट क्या है? पेन किलर्स हैं एंड फ्लूइड देते हैं, आप रिसेसिटेट करते हैं. जबकि एसवीटी आपने कैसे अब्रप्ट होता है? एडिनोसिन से रिस्पॉन्स आता है, ठीक है? एंड इन एसवीटी you may have underlying cardiac disease as well and maybe not, सही है? And you may have a history of palpitation and these situations like that, and there is a little change in rate with activity crying. So जो आपका टैकिकार्डिया साइनस है वो रोने से एकदम तेजी से शूट करता है, लेकिन जो एसवीटी का टैकिकार्डिया उसका इतना ज्यादा रोने पे उसको फर्क नहीं पड़ता है, ठीक है? So we just covered this T waves and then we will finish, and tomorrow we will continue the remaining part with some practicing ECG. So what is the rule for T wave? So always remember that for T wave, please remember that the T wave is upright in all lead except V1. Except V1. तो आपने T wave में V1 को जरूर देखना है. V1 में आपको डाउनवर्ड मिलती है. नॉर्मली आपको कैसी मिलती है? V1 में डाउनवर्ड मिलती है. So if you have an upright T wave in V1, that shows this is right ventricular hypertrophy. तो एक आपको राइट वेंट्रिकुलर की अगर आप बात करें तो वेंट्रिकुलर का स्टेटस आपको QRS कॉम्प्लेक्स और T वेव से पता चलता है कि वहां मसले क्या है. सो V1 में अगर अपराइट आपको T वेव मिल रही है, दिस इज एबनॉर्मल. कब एबनॉर्मल है? अगर आपको मोर देन 7 days और अंडर 7 year, ये 7 याद. तो जब 7 साल से बड़ा बच्चा हो जाता है तो उसमें अपराइट ही होती है V1 में भी T वेव्स. लेकिन अंडर 7 year अगर अपराइट आपको T वेव मिल रही है इन V1, दिस इज एबनॉर्मैलिटी. ओके, दूसरा T वेव आपने क्या देखना है? इन्वर्टेड T वेव्स. एक तो आपको बता दिया कि सारी जगह अपराइट मिलेगी एक्सेप्ट V1. अगर V1 के अलावा कहीं और आपको डाउनवर्ड मिल रही है तो वो क्या शो कर रही होती है? वेंट्रिकुलर स्ट्रेन, स्कीमिक, कि वेंट्रिकल पे प्रेशर है, स्कीमिया हो रहा है, ठीक है? और वो स्कीमिया आप कहाँ देखते हैं? अगर लेफ्ट साइडेड प्रॉब्लम स्कीमिया जो है वो वेंट्रिकल को जो लीड्स देख रही होती हैं वो लेटरल लीड्स देख रही होती है. उसमें लेटरल लीड्स कौन सी हैं? V4 से V6 जो कि लेटरली लगी हुई होती हैं, लीड 1 जो कि आपके जो है वो लेफ्ट साइड को देख रही है, और AVL जो आपके लेग पर है, ठीक है? सो ये वाली लीड जो है वो लेटरल लीड्स कहलाती हैं, और उसमें आपको अगर इन्वर्टेड T वेव्स मिल रही हैं, दैट शोज स्ट्रेन. अब स्ट्रेन किस में मिलता है? हुकुम की ECG में मिलता है. ऑब्स्ट्रक्टिव कार्डियोमायोपैथी. एक और कंडीशन होती है एल कापा, जो हम कल डिस्कस करेंगे. एल कापा क्या सिचुएशन है? हार्ट की सप्लाई का प्रॉब्लम है, ब्लड सप्लाई, उसमें आपको स्ट्रेन मिलता है. और स्ट्रेन कहाँ पे मिलता है? लेफ्ट वेंट्रिकुलर हाइपरट्रोफी हो रही है, वहां पे स्ट्रेन मिलता है. स्कीमिक हो रहा है पेशेंट, वहां पे स्ट्रेन मिल रहा है. तो जो स्कीमिक रिवर्सिबल होते हैं वहां पे आपको T वेव्स के स्ट्रेन्स मिलते हैं. टॉल टेंटेड T वेव्स अगर आपको मिल रही हैं तो ये कैरेक्टरिस्टिक होता है हाइपरकेलीमिया का. So normally T wave की लेंथ क्या होनी चाहिए? It should be less than 2/3 of R wave. Okay? Normal आपकी T wave की लेंथ क्या होनी चाहिए? 2/3. अगर आप QRS कॉम्प्लेक्स का लें तो उससे छोटा होना चाहिए T waves को. तो अगर आप इस V3 की स्लाइड्स पे देखें, ये काफी लंबी हो गई हैं, 2/3 को क्रॉस कर गई हैं. That means these are tall tented T waves, which is characteristic of the hyperkalemia. Okay, so we just end our session over here. If you have any questions, you can ask tomorrow. You can write it down your questions if you have any queries. So we will meet inshallah tomorrow at the same time at 8 p.m. And again, it's a free session for all. Okay. Thank you so much, everyone. Allah Hafiz. Take care.